mother-child booklets, the Kenyan version actually. This is what is in Kenya, and I'm going to show you exactly what is expected of you during pregnancy, during delivery, and after delivery. That is written in this book. This book here is written Mother and Child Health Handbook. Actually, it shows that the whole health of pregnancy, delivery, and even after pregnancy lies in the mother's hands. If it was something to do with the dad, maybe they could have included. But again, the whole pregnancy thing and childbearing lies with the woman. So this book here, ukiendanga hosi utakuwa unapewa, but most of the people huwa hawapati nafasi ya kupitia hii kitabu. Wanatoka clinic unapata tu ameiweka kwa bag, anaungoja the next time, akienda clinic anaitoa na anaenda. Take your time to read this book. It's written in very, very simple language, like simple English, yenye unaweza elewa vizuri sana. This book here, first page inaibeba, ukifungwa tu hivi, you will read all those, alafu unaenda. The first thing yenye tunaanza hapo nazo utapata the further support for mother and child health. The support that you need to get from your husband. Imeenlighteniwa hapo vizuri during pregnancy, during childbirth, and even after childbirth. Actually, if you cannot tell your husband what he is expected to be doing, then unaweza make very easy. Mpe kitabu asome. Just give him this book, atajua ni what is expected of him to do during the pregnancy period, like making sure you have a house help in the house so that you cannot do some of the extra tedious duties. And again, I make sure there is food in the house. And during childbirth, your husband has duties like making sure the transport to the facility is available. Akwe company hapo, anaweza kaku encourage time yenye uko na mauchungu, and even helping by rubbing your back during contractions. And after childbirth, imeelezwa hapo vizuri. Ukienda kwa the third page, tuko na family planning. To have healthy mothers and babies, it is best to space your children. Hiyo inaongelea tu the spacing that you'd want to use. Actually, you will discuss family planning issues before delivery. That is how it is expected actually, and that is the correct way. That unaenda unakaa na health worker. Hiyo time yenye utakuwa unaenda clinic, ongea na huyo muuguzi umwambie, mimi nikishajifungua I would like kukaa like after 3 years ndio nizae mwingine tena. So hapo ata discuss na wewe the best family planning method yenye unaweza tumia, because most of these methods actually currently they are being used, they can even be used immediately after delivery, except for some few. Next page is maternal profile. Actually, this is much of a history page. Ita depend tuna jina yako. This is always filled up by the health worker. Alafu hapo utaenda kwa the history, brief history of your previous illness or any other thing that you've encountered that the health worker would want to know, the previous pregnancy. Page 7 of 44, tuko na what we call antenatal profile. Antenatal profile carries all your investigative history. Hapo tutajua kiwango cha damu, blood group yako, the resa, serology, hizo magonjwa za zinaa zitatestiwa kama uko nayo. Kuna hiyo TB, HIV, utatestiwa mkojo kujua kama kuna shida yoyote. Then on the page 8 of 44, hapo itakuwa ni pale pa muuguzi ataangalia how you're gaining weight. Actually, your weight during pregnancy is quite important, and that is why kuna hiyo weight gain chart. Kuangalia kama, cause actually if there is a growing life inside you, we expect you to be adding weight gradually. And it depends on how on which gestation the pregnancy is. For that, tunaenda kwa vitu tunaita preventive services. Page 9. Preventive services, hapo tutakupea nini za kusaidia viungo vya mtoto kugrow, zinaitwa IFAS. Juu kuna tetanus toxoid, very very important jab during pregnancy. Page 15 of 44 is very very important page, and you really need to go through it if you have this book as an antenatal client. Care during pregnancy, what you are expected to do during pregnancy or not to do. Actually, apart from the many things that you've been told, like you are not expected kuvuta sigara, kunywa pombe and all that. Eat one extra meal every day during pregnancy. Extra meal, a whole meal and not a snack. Uchumi na ni mbaya. Then eat plenty of fruits and veggies. very important. Then drink plenty of water, and at least 8 glasses of water, that is 2 liters per day. You have to take your folic acid tablets on time and correctly, do not skip. Then avoid heavy work, rest more. Actually, you need at least 8 hours of sleep. And avoid heavy work like lifting heavy loads, avoid that. You have to sleep under your long-lasting insecticide-treated mosquito nets to prevent malaria actually. And you have to go for antenatal visits, and at least 4 times during pregnancy. The danger signs, signs that you are not expected to be seeing during pregnancy. Illustrated with pictures, we have severe headache, pale, that is being pale, vaginal bleeding is not expected, very, very weak. You've seen that picture cycled inside there, being accompanied to the hospital. If you have fevers, it can be a sign of infection. Convulsions are very, very dangerous during pregnancy, and if you have severe abdominal pain, that too sio mzuri. And again, you have to track your fetal movements. Hazifai kupungua, like mtoto alikuwa anacheza, then all of a sudden your kid is not playing. That is quite dangerous. Umeambiwa breaking water, getting tired easily, swelling on the face and hands, breathlessness. Be prepared always to seek skilled care in case of any of these signs. You must have your birth plan. This page is for the health workers use, delivery, everything hapo. Alafu care of the mother and the baby after birth. Immediately umejifungua, what is expected of you ukijifungua? 2 extra meals during breastfeeding period, and it should be a meal. Those are different from snacks. Ukaambiwa give only breast milk to the baby. Nyonyesha tu, sipeane kitu. Keep your baby warm all times. You have to ensure that your baby is very, very warm. Then mlale chini ya neti, alafu unaenda clinic ya postnatal. Kuna hapo guideline for healthy eating. What is expected of you, vile unafaa ukule and everything, the classes of foods. Kindly find time to go through it. The veggies, the starch and all that. Umeambiwa, if at all you see this kind of signs, please find time and go to the facility. You are not supposed to be seeing heavy bleeding again. Heavy bleeding is a very bad sign postnatally. Inamaanisha unaweza kuwa na what we call postpartum hemorrhage, secondary actually. And again, fever can be a sign of infection. When your baby is not breastfeeding well, that is a very dangerous sign too. You have to get her back to the hospital. Or when your baby has difficulty in breathing or breathing very fast. If your baby feels hot, your baby becomes less active, or the baby becomes yellow, especially on the eyes, palms, and soles. It can be what we call jaundice actually. If your baby becomes yellow, you really have to take the baby back to the hospital. Page 22 of 44. There carries the whole details of your child, including the birth weight, the birth notification, facility where the child was born, your details, the dad details, and everything. And actually people are losing the birth notification, so there is a place where birth notification number is written for easy usage in the future. Actually, utakuwa unatafuta birth certificate and maybe ushapoteza notification, so it will be easy for you kwenda huko na unawaonyesha to the birth notification number. The rest are for clinician. I'm still going to get somewhere where you are really supposed to know. Those are disability identification, maybe. This one is a clinician. Development milestone. Yeah, what is expected of your child during development. Kuna wenye wanaharakishanga mtoto, unapata ti wangu sijui ako 2 years na hajafanya nini. No, there is a way that things are expected. Like we have social smile, we have the normal limits. The normal limits ni 4 to 6 weeks. Ile smile yenye wanaekanga tu like umeona mtoto na smile tu anyhowly. That is between 4 to 6 weeks. Then we have head holding, stroke control. Vile anaweza akiinua kichwa na anaweza iweka steady without go flap round. Hiyo ni 1 to 3 months. So wako akianza na 1 month na mwingine yake anze na 3 months. Msianza ati wangu sijui alikuwa nini. No. Every child bora ako within the normal limit is okay. Tuko na turn when your child can turn towards the sound, like ukimwita baba, then she turns or he turns. That is very okay, and it should be done within a period of 2 to 3 months. Aki-extend mkono grasp toy 2 to 3 months, akijaribu kukaa ni 5 to 9 months, see all that time allowance. Alafu mtu unapata mtoto wake amekaa na 6 months, mwingine 9 months, na wanaanza kucompare. Standing ni 7 to 13 months, walking 12 to 18 months, and talking ni 19 to 24 months. Actually, every kid pia ni different, and we have different things in our. So akichelewa usikwe na like, umeona ni 12 to 18 months akitembea 1.5. Kuna wenye wanatembea hata na 10 months, na wenye ametembea na 1.5. They are both okay and normal, as long as it's within the normal limits. So you really need to treat this kid too as a special kid. Mtoto wa teenage mother, brothers or sisters undernourished. Yeah, kama kuna malnutrition kwa nyumba, ukiwa umezaa twins or more, mtoto akiachwa na mom, actually more so mom, an orphan, child akona disability, HIV exposed infant, and any other actually. Then we have this weight for boys, weight for girls. So you have to be taking your kid. Hii weight illustration imefanywa vizuri. Every month peleka mtoto, na imeonyeshana hata meals zenye mtoto anafaa awe anakula kila siku. If you're keen, you can use, if you have this book in the house, you can see mtoto akona the meals zenye anafaa kule kila siku, na unaangalia kilo. Ukiangalia ikiwa kwa red, the graph when it's in red, that is not gaining weight the correct way. Green is okay, but again, obesity is above yellow na uko mbele. Hapa utakuwa unapewa the dates za kurudi kila siku. Alafu hapa is very very important, your immunization history. Vitu zote zenye mtoto anafaa pate from BCG, polio vaccine, inactivated polio vaccine, DPHT, pneumococcal, rotavirus, all the vaccines that the baby is supposed to be getting. And currently we also have the malaria vaccine, though not here, though there is malaria vaccine. Then tunakuja hapa. Hapa kuna vitamin A na dewormers. Very very important. But utapata kama mtoto amefika to 9 months or even 1.5 years, kasha pata yes ndani ya 1.5, mama anachanga kupeleka mtoto. That is quite wrong. The baby should be taken to the clinic up to 5 years of age. Usipompeleka, please find time umpe vitamin A na dewormers after every 6 months. Like akiwa 1 year unampea, 1.5 unampea, hivyo mpaka afike 5 years. Itamsaidia kwa growth. Usiabandon mtoto bila kupata vitamin A ati amefika 1.5. Very very common behavior na Kenyan mothers. Kama mtoto alikuwa mtoto wa mama mwenye anatumia dawa za virusi vya ukimwi, fanyiwa first DNA PCR at 6 weeks, atakuwa nafanyiwa DNA. Akifika 6 months tena nafanyiwa DNA PCR kuangalia kama mtoto ako positive ama unafanya vizuri na kupeana dawa na kunyonyesha only. Then we have a confirmatory PCR kama mtoto by 12 weeks. If in case any of these PCRs zimeturn positive, then there is a confirmatory PCR. But ukienda tu vizuri, the last one will be done in 18 months, na itakuwa ni antibody test just to determine whether the baby is okay. It's important you have to adhere to your drugs and breastfeed your baby correctly, and you too, you have to eat correctly. In case the baby is sick, kindly take your baby to the clinic. We also have the feeding recommendations on how you can feed your baby. Actually, find time to read it, page 41 of 44. That shows you from newborn birth up to 1 week how you should be breastfeeding your baby. And if the milk is not enough, you only have to seek an advice from a health worker. Exclusive breastfeeding is what is recommended in this page. How you'll be doing it from 1 week up to 6 months. How you'll introduce other feeds from 6 up to 9 months. Throughout from up to when your child will be 2 years and above. Find time to read. Yeah, I know maybe you've never opened this page actually, because most mothers seem not to know this. Pictures, you've been told on how to interact with your baby, how you can be playing with your baby, how you can communicate with your baby. Very, very quite interesting. Yeah, up to 12 months, and you're going to do that up to when the baby will be 2 years older. The last page here, which is very, very important, Umeambiwa when to return to the facility. When are you supposed to be returning to the facility? Immediately. Umeambiwa bring any sick child. If the baby is not able to drink, the baby becomes more sicker. Hapa ulikuwa ushatibiwa, maybe akaendelea kuwa mgonjwa sana, peleka hospitali. Akiwa na joto, peleka hospitali. Damu kwa choo, peleka hospitali. Hakunywi maji vizuri, peleka hospitali. Akiwa na shida kwa kupumua, enda hospitali. Akipumua kwa haraka, kama hanyonyi vizuri, na kama unashuku tu mtoto wako si sawa, wewe enda hospitali. Mtoto wako akiwa mgonjwa, hii kitabu hapa kinakueleza jinsi unavyofaa kuendelea kumpea mtoto wako maji. Yeah? You are supposed to breastfeed frequently and for longer periods when the baby is sick. Increase the amount of fluid, like unaweza mpea maji, rice water, yogurt, any drink. And keep on giving more fluids. Na mtoto kama naharisha, unampea ORS. Dear mother, get time to read this book. It's written afya ya mtoto na mama, and not ya baba. Actually, if it was something to include the dads, maybe they could have included them. But again, it's written afya ya mtoto na mama. Thank you. I'll be back again with more.